Section 3. The Clinical Encounter. Welcome to the narrative video on clinical encounters for new interpreters. In this video, we'll explore the various phases of a clinical encounter and the interpreter's vital role in facilitating effective communication between the medical provider and the patient. As the medical provider enters the room, the interpreter follows suit. The interpreter introduces themselves to both the provider and the patient, establishing a rapport and ensuring clear communication channels from the outset. Throughout the clinical encounter, the interpreter plays a crucial role in facilitating communication across various phases. Throughout each phase of the clinical encounter, the interpreter should be fully engaged, understanding the context and trajectory of the encounter. It's essential not to focus solely on listening sentence for sentence, but to grasp the overall purpose and direction of the conversation. Remember the steps of interpreting and clarification protocol, the phases of the medical encounter and the interpreter's role. 1. Medical history. The interpreter assists in conveying the patient's medical history accurately, ensuring that all pertinent information is communicated between the provider and the patient. 2. Physical examination. During the physical examination, the interpreter provides privacy to the patient by stepping back or turning away, allowing the patient to feel comfortable and respected. 3. Discussing diagnostics. When discussing diagnostic tests or results, the interpreter ensures that the patient fully comprehends the information provided by the provider, clarifying any medical jargon or terminology as needed. 4. Plan of treatment. The interpreter facilitates discussions about the plan of treatment, ensuring that the patient understands the proposed course of action, including any medication or treatments prescribed by the provider. 5. Instructions for medications or treatments. Clear and accurate interpretation is essential when conveying instructions for medications or treatments, ensuring patient safety and compliance. 6. Follow-up, care and appointments. The interpreter interprets for the patient when scheduling follow-up appointments and conveying and post-appointment instructions or recommendations from the provider to the patient. Throughout each phase of the clinical encounter, the interpreter remains impartial, ensuring that information is conveyed accurately and without bias. Additionally, the interpreter maintains patient confidentiality and professionalism at all times. As the clinical encounter concludes, the interpreter ensures that all communication between the provider and the patient has been accurately conveyed and understood. They remain available for any further